Chikungunya.
Warning travelers about a
Breaking
painful
news,
mosquito-borne
outbreaks
virus.
of
On Friday,
In
this
mid-2025, Guangdong Province in southern China faced a major Chikungunya virus outbreak. Over 7,000 cases have been reported, mainly in Foshan, with spread to at least 12 other cities, and even one linked case in Hong Kong. The virus doesn't pass directly between people. Instead, it spreads when a mosquito bites someone who's infected, then bites others. This is called vector transmission. Chikungunya is a mosquito-borne virus first identified in Tanzania in 1952. The name means that which bends up, describing how sufferers move due to extreme joint pain. Key symptoms: high fever, severe joint pain, headache, muscle pain, rash, swelling. Most people recover in about a week, but joint pain can linger for months. It's rarely fatal, though infants, elderly, and those with health conditions are at higher risk. Currently no cure or widely available vaccine, though the US has approved 2 vaccines, one with concerns for older users. China launched a massive response, using strategies similar to its COVID-19 efforts. Mandatory hospitalization for all infected patients, with mosquito nets over their beds. 7-day stays until they test negative or complete the period. Fines up to 10,000 yuan, approximately $1,400, or even electricity shutoffs for households failing to eliminate stagnant water, mosquito breeding sites. To control mosquito populations, authorities deployed drones to scan for and map areas with standing water where mosquitoes breed. Mosquito-eating fish released into parks and lakes to eat larvae. Elephant mosquitoes, a giant, non-biting species, toxorynchites, whose larvae prey on Aedes mosquito larvae. How Chikungunya compares to other viruses. Malaria is caused by a parasite, not a virus, and can be fatal if untreated. It's mainly transmitted by Anopheles mosquitoes. A Zika virus shares the same mosquito vector, Aedes, and similar mild symptoms, but it can cause serious birth defects in unborn babies. COVID-19 spreads between people, not via mosquitoes. Unlike COVID, Chikungunya is not contagious person to person. Why now? Warm, wet weather in Guangdong triggered larger mosquito populations this summer, creating ideal conditions for transmission. Climate change helps mosquitoes expand into new regions, making diseases like chikungunya more likely to appear in places they weren't common before. There is no cure or vaccine for chikungunya virus yet. The following tips can help you stay safe from chikungunya virus. Avoid mosquito bites. Wear long sleeves and pants, use mosquito repellent, and sleep under netting. Remove stagnant water. Empty containers like flower pots, bottles, cups, even tiny amounts of water. Use screened windows or air conditioning. In outbreaks, follow public health advisories, including potential travel warnings and quarantines. Share this information to alert and protect your family and loved ones. Don't forget to like and subscribe. Thanks for watching.